Good evening, everyone. Thank you for joining in today. Myself, Meghna Khan. I'm a career coach with the industry experience of 15 years. I basically help students in aligning their interests, strengths, and passion into respective career fields. And today we are here to discuss about medical profession, and we have two experienced and qualified doctors with us here. It's Dr. Nazish and Dr. Zahid. Thank you so much for taking out time to help us, the parents and the students, knowing the inside out of this profession. Welcome.
It was our pleasure.
Yeah.
Welcome.
I'm excited to see that there are so many students who have joined this, students, parents, and I think I'll just start right away because as people will come, they can join in. Let's start this webinar. And before we go ahead, I would like to give a brief introduction about Dr. Nazish. She is a family medicine consultant with over 15 years of clinical experience from various parts of UK. She qualified with MRC GP from Royal College of General Practitioners, London. Dr. Nazish is a member of General Medical Council as well. She strongly believes in managing patients holistically with an empathetic approach towards building a healthy community. Thank you, Dr. Nazish, for taking out time for us today.
Thanks. That's a wonderful introduction. Thank you.
My pleasure. Then we have Dr. Zahid. He's a British trained family medicine doctor and 18 years of experience based postgraduate graduate clinical experience. He completed his post-graduation from Royal College of General Practitioners in London with a gold medal. That's amazing, Dr. Zahid.
Thank you. Thank you very much.
He also carries over 10 years of clinical experience in emergency medicine, gaining the clinical expertise in managing acute and life 2019 and has been working as a family physician since, contributing extensively in community-based healthcare in Dubai. Thank you, Dr. Zahid. Thank you so much.
Thank you. No, thanks for the invitation. Thanks.
Yeah, you both are going to be the guiding angels for many of us today, and help us in facing the the real side of the profession, how you guys have become so successful in your respective fields. So I would like to start this thing with both of you can answer this question one by one. It is, what questions one should ask themselves before committing to career in medicine? Who would like to go ahead first?
I don't mind. Do you want to start, Dr. Nazish?
So, I mean, I remember when I got into medical school and I broke the news to people around me saying that I'll be starting medicine, the common response that I got from children my age was, oh my gosh, that's so many years of studies. I can't do it.
True.
And then over the years, as I grew older and learned and read, the first mistake we make is say we can't do it.
Yeah.
So yes, this profession involves lifelong commitment, but if we start with the outlook that I can't do it, then there's nothing that any of us can do.
Right.
Yeah.
What would you say, Dr. Zahid?
I think it's, I would totally agree with Dr. Nazish. I think it's the lifelong commitment, which is very important, because it's lifelong learning, actually. We still have to learn new things, new guidelines, how to treat patients, because there are new medicines coming up all the time. So it's a lifelong commitment. And you have to sort of, you have to be committed to your educations, that sometimes you miss important occasions as well, like birthday parties, like marriages. You sometimes you have to miss. My wife was actually lucky that I was there in our marriage.
You're selling off yourself well.
Yeah.
Okay. So what was the reason you selected to be a doctor?
For me, it was my paternal granddad. He worked as a physician, and I still remember the smell of medicine in his room. You know, I still remember the shelf where I would see medicines. I still remember his doctor's bag. And I have a very vivid memory of, now I am good with memory, as in I still remember very clearly when I was 3 and he had to visit a patient's home to give them an injection, an elderly lady. So that inspired me, because his routine of waking up and the smell of medicine and his noble attire used to inspire me. And I decided very early on that this is what I wanted to do, which is why, going back to your first question, that thought never occurred to me that, oh my gosh, this will involve lifelong learning.
So when you, I can clearly understand that you were inspired by your grandfather. And but at any point of time did you feel that, you know, did you wanted to rethink about your decision?
Yeah, of course.
Really?
Yeah.
Okay.
Yes, I wanted to. So when I was 10, I wanted to be a writer.
Okay.
And that's still in me. So I don't think that we can limit ourselves to just one profession. You can still be more. I still write. When I was about 15 or 16, I wanted to completely change fields and go into computers.
Okay.
So, but that was only because I scored full marks in computer science. So I thought, okay, this is easy. I can do this.
Yeah, that's well said. Yeah.
Yeah, so I think it's pretty natural for children to have a change in their opinion at some point. And that's where guidance, like yourselves, you know, what you're doing is really important, because children need someone to understand and to help them make that important decision as to what they want to do in life.
Yeah, that's a good tip. In fact, I liked that you said that you wanted to do computers because you got good marks in computers.
Yeah.
So I recently met a student who selected his engineering in chemical field, and he was very adamant that I only want to do chemical. And then when we had a session and we digged out, it was because his chemistry teacher was too good, and he has started scoring well after being in touch with him. So he just thought that chemistry is the field for him. But later on, he settled for mechatronics, you know. So once we did the session, so it's important to understand that whatever you are thinking about yourself is actually your reality or not, or is it aligning with your interest or not? And what about you, Dr. Zahid? Did you feel at any point of time that, you know, this is not my cup of tea?
To be very honest, for me, I don't know. I've seen my dad actually, and he would, anything in our house, if it's not working, he would sort of try and fix it. I'm just giving you an example. If a watch or a clock or sort of a washing machine not working in my house, he would sort of, sort of dismantle it and try and fix it. So I don't know. I grew up seeing him, sort of making stuff, making sure things are working.
Yeah.
So I don't know. For me, I became a doctor, but that thing was missing. That you can fix and you can see the results straight away. So I obviously, being a doctor, you have to go through a lot of specialities, like you do surgeries, medicine, pediatrics. Then you go do gynecology as well. But when I reached A&E, this is where I thought maybe I can combine medicine with skills, which I sort of maybe by seeing my dad.
Yeah.
So what I mean by that is I would see patients who would come with dislocated shoulders, like the shoulder joint would be out of the joint. So I would sort of, they will be screaming in pain, and I would put it back, and straight away the pain would go. So I think that I could sort of combine, and I thought, maybe I can sort of combine my passion of like sort of, engineering into medicine.
Yeah.
Changing career. I think you sort of, what I've learned with experience, with sometimes in our profession, you find it's not very easy. It's very difficult with going through exams and everything. So mentally you have to be very strong.
Yes.
And sometimes you start thinking you cannot do it.
Yeah.
But I think I would like to say
that was my next question with you, that
oh, is it okay?
Yeah, that how important it is to be mentally strong for this profession.
Definitely.
Students who are aspiring to be doctors, I mean, it sounds very, easy that yes, I know it's it requires a strong personality. But have you analyzed how important it is to be mentally strong? By the times, I mean, you can see you have been you might have given your 100% in saving a person, but at the end of the day, the result was not in your hand. So what makes you, get up, build yourself again, and then go and treat the other patient on that part? Dr. Nazish, you want to go ahead?
So, yes, in terms, so your question is that do you need to be mentally strong to be a doctor?
Yes. How important it is to be mentally strong for this profession, except the studies and all the technical information, how important this attribute is.
It's a very important attribute, but I would say that the strength comes through experience and with time. It's not
That's a good point.
Yeah, it's not like anyone was mentally strong from start, whoever joined this career. It's through immense support from your seniors, from your teachers, from your friends. And that's what brings you to the point where you gradually, I cannot remember at what point I would say that suddenly I became very strong. It happened over time. If I give you an example, so these are again going back to when I was 17 and I started medicine. One of the other comments that students my age would pass is, "Oh my God, I can't imagine the sight of blood. I cannot stitch things up. I cannot do autopsies."
That was my reason not to pick up medical profession as well.
But there's no one, I would say, who's ever prepared to dive into that. It comes through a lot of support, and it comes very gradually. So they don't just shove you over there immediately as you start. The first dead bodies that we saw and the autopsies that we did, they didn't really look like they were ever alive. It was more like statues. It's very different. And when I was 22 and I first did a forensic medicine class, and the man had died a day before. I'm sorry, I have to be blunt and say these things because we're talking about medicine.
This is what we want to. We want to bring the real side of the profession.
Yeah. So I was 22, and the man who we were going to do an autopsy on had died a day before, and he was 23. He was a very good-looking man with a French beard, this length hair. And that was a fresh dead body, someone who had died a day before. He still looked like he was asleep. By that time, I had finished many years of medicine, but that was difficult. That was difficult to see someone my age lying there. And I remember coming home and telling my dad, I'm not going for the forensic medicine class again. This is after I had seen frogs being dissected. I had held hearts in my hand, kidneys in my hand, skeletons in my hand. But this was different. So there are stages which still come in a doctor's life. You're never fully strong. Challenges still come. And my dad said, no, you are going there. You are going back in class, because that's how, with the exposure, you will learn to have that strength.
So you're saying doctors are human as well. They will not
human.
be pre-configured. They need to develop over the period of time.
Yeah, and we still break down as humans. We still, so you're never going to be tough enough for everything that comes your way. And it's okay to not expect 100% from yourself all the time.
Right. That's a very good tip, Dr. Nazish. It's okay to be not perfect all the time.
Yeah.
What do you say, Dr. Zahid?
I think mentally I would say mentally you have to be strong. But again, as Dr. Nazish said, I think it's with experience, with learning, with support. Because in medical profession, you get a lot of support, a lot of support from your seniors. With education, you become mentally strong, and it gradually happens. It just doesn't happen. So, to be very honest, I was scared to see blood. I would to be very honest, I would faint. when I started doing medicine, this is like a funny story. I don't know. I'll try and explain in simple words. Sometimes they have to take fluid out from the spine, which is backbone. So I saw that in my I didn't finish my medical school, but when I saw that, I was almost about to faint. And there was a guy who was cleaning the room. He came to me, he said, "Are you okay, doctor?" And I almost fainted. So he gave me a water bottle. But now, I mean, working in A&E, I've seen like big cuts, patient coming with broken bones, like big bones, a lot of bleeding. And I have helped them or treated them very well. And it comes with with experience, you become more strong. And I think it doesn't matter in all field, no matter which field you go, the more you challenge, if you want to go in high in position, you have to challenge yourself.
Yeah, true.
And
so, doctor, what is a day in your life? How does your a day-to-day, things happen at work? And of course, you guys have seen the COVID times. How did it impacted your routine? How it, you have to work in probably. I'm thinking that you might be working over, hours because of the rise in the cases in the past. So how is your day at work?
Do you want me to start, or Dr.
Anyone
Nazish?
can do that.
Okay. Okay. I think, to be very honest, even before COVID, when I was doing my training as a general practitioner, family physician, what they call it, I think officially it doesn't look that busy, but we used to have like 1 and 2.5 hour surgery. Surgery, we say basically clinics. We're seeing patients like for 2.5 hours, and then evening as well, we would have 3 or 3.5 hours clinic where we would see one patient in 10 minutes.
Okay.
So we literally get 10 minutes. And if it's an elderly patient, they walk in, obviously they have to in UK, they wear a jacket or they're carrying a stick. They have to keep that jacket on the side, sit down, and 2 minutes are gone. So you're literally left with 8 minutes where you have to talk to the patient, diagnose them, and treat them. So it is very busy, and sometimes obviously we never used to get a lunch break as well. So that's the challenge. But on the other hand, I think it's satisfying because you feel you have helped people, and it's a noble profession.
Yeah.
So that's how day is like, in the morning I would do clinic, in the afternoon we will have to go and do home visits, see 2 patients. And then in the evening as well, we'll do clinic, and then we can get some emergency cases as well. So that's how it is.
Yeah, that's what you said is very nice, that, if somebody has a real passion towards human life, then this is the best profession to pick up. But you need to really validate that is the driving force by picking up this profession, is this cause, or you are thinking on the other guidelines. I have one question here from Shraddha. She's saying doctor's profession is a profession of sacrifice. Am I right? My second question is, how long does it take for a medical to become a full-fledged doctor? Dr. Nazish, you want to say on that?
So in terms of sacrifice, I would like to it depends on what she means by sacrifice. If it's sacrifice in time, then yes.
I think that's a parcel of all the professions now, even if you are in IT field, you are in education field, time you have to, compromise and sacrifice.
Yes, that's true. And it is one of the, I'm not sure how many years engineering or law is, but yes,
it's 4
medicine,
years.
4 years. So then medicine is 6 years.
Yeah.
So 6 years of medicine. And then in UK, the internship used to be 2 years, not 1.
Yeah.
And then after internship, you don't practice independently. You still have to choose a career pathway and become a specialist in one field or the other. You can't just finish after your house job or your internship.
Okay.
So then it depends on which specialty you choose. The longest one is neurology, which is 7 years.
Okay.
But that doesn't mean, so when you finish medicine after 6 years, you start working. So even though you're doing your internship, you get a salary per month. It's just that they don't, because we're dealing with patients' lives.
Yeah.
So you're not left to practice independently until you become a fully fledged member of a Royal College of some of the other specialties. So that takes many years. But you're still practicing as a doctor with support from your seniors.
So the journey would begin after the initial 6 years of the degree, and then they have to do the building blocks, keep on studying and specialize and have a growth further.
So mentally, psychologically, you can think that I'm still training, but not really, because you do start earning after your 6 years of medicine.
Because, many times it happens that a doctor has such a long duration of studying, and all the other friends in the different fields are already settled, earning good salaries, settled life, whereas the life for a doctor probably starts in late 30s or early 40s.
Yeah, that's true. I would agree. It starts in the late 30s, early 40s. By that time, you are at consultant level and you do not need. But even then, things have changed now. You still need someone senior to mentor you. To look in UK, we have to still have an appraisal every year. We have to still show that we are learning regularly. We're keeping our knowledge up to date. So it never really ends. And if you remember that the idea is that you are dealing with people's lives and it's important to stay on top of that knowledge, then it doesn't become a burden. I don't know, at one point it stopped. I can't remember at what point it stopped becoming a burden and it became more like my duty, that I have to stay up to date so that I know how to treat that patient well.
Okay. She has another question. She's saying, which country is ideal for the medical research with all infrastructure?
I think, if I'm not wrong, America is involved in a lot of research. America and Canada, I would say, if that's the question, yeah.
So does she mean clinical research, as in
clinical
trials?
research,
yeah, medical research, she has mentioned.
I think they do in Europe, in UK, everywhere, but and sometimes like there are big companies like GSK.
Even I heard Germany is becoming a good hub of research work.
Yeah, and mostly what they do is the research is done internationally. So they look, if let's talk about a medicine. If you're talking about a medicine, they are researching. So they do in different ethnicity as well. Like they see one drug, how it reacts in in Japan or in Asia or in Caucasian. So they are international. Internationally is done, but America is the big hub.
Now I have a very tricky question for both of you. So what I would like to ask you is that what was the experience? You enjoyed the education phase more, or you are enjoying your after that work experience and learning procedure? What was the most interesting part in your journey? Dr. Nazish, you want to say?
So, I mean, if you're talking about just being in university, attending lessons and being academic, that only brings me memories that I was very young. So it brings me memories of being youthful and full of energy. But then being able to apply that knowledge, something as simple as I can watch videos and I can read about how to draw blood. But I still won't know how to do it until I practice it.
Practice that, yeah.
So being able to practice has its own, it's very rewarding when you practice and you see a patient get better and they come back to thank you.
True. It's I know that feeling.
Yeah.
Yeah. Okay. Do you want to say something on that, Dr. Zahid?
Yeah, but I think education is also needed. That's also a very important part.
Yeah.
Because once you have knowledge and education, then you would be more
It sets
confident.
the foundation for you.
Yeah, it sets the foundation. Yeah. So both parts, I think.
Mm.
And I think, I don't know, at some stage, I became sort of, I have to study. I like studying. If I'm not studying, I feel like I'm lost, actually. I'm not doing anything. And yeah, you have to keep studying new things, what research is going on, so that, you're fully aware, because now, because of internet and everything, patients have got a lot of knowledge. So you need to keep up to date with your knowledge as well.
The Google knowledge.
Yeah, the Google knowledge, because they talk to sort of Dr. Google first, and then they come and talk to us. So
I know. I trouble my doctor as well a lot. And, I will tell him that, why don't you do this test for me? Then he tells me, I'm a doctor. You don't do over research.
But it's important because it's your body, and you have every right to ask. If you read and patients come, they bring newspaper cuttings, they share information. A patient came to me once he was in his 40s and he was getting acne. So he came to me saying that, why am I being prescribed this antibiotic? Why am I not being prescribed this medicine instead? So then we researched as a group of doctors, and we discovered that it was a new medicine. It had just come in the market. It was actually working better.
Yeah.
So he was right. Which is why, like Dr. Zahid said, it's so important that education and experience, it has to continue together.
Yeah. And that's good. You were open to the suggestions. It's very important to take the suggestions and then work in that direction.
Yeah.
I have a question from Mr. Jain Sharma. Good evening, Jayant. I wanted to ask, what are the possible professions we could get into with medicine and psychology? So I think what he's trying to say is that, what are the alternative career choices or fields, people can select if they are not able to do this medical course for 6 years, but they still have the inclination towards the healthcare industry. What other alternative fields are available to be connected to this line, this line of profession? Like, psychologists, clinical psychology, or psychiatry, or, there are many other which I see popping up. Dermatology has taken so much of, so for that also you have to complete your medical degree, or they can do a BSc or any other kind of bachelor's shorter duration course and go for it.
I think what happens is, so with dermatology and with psychiatry, you have to have your basic medical degree. Then only you can become a psychiatrist. Obviously, you have to do another, like psychiatry is, and dermatology is another specialty. So you have to go through the training.
Okay.
Psychology, you don't need to have medical degree, and as well as we have physiotherapists and occupational therapist and working in a lab as well. So you don't need to have a medical degree. You can still work in those fields.
Okay.
And I think the main thing is that, when as a doctor, people think, okay, doctor is doing everything, but it's a teamwork. When let's say when we discharge a patient who has had a stroke, we won't be able to discharge them if we haven't got physiotherapist or occupational therapist, which basically look into things how patient will manage at home, like occupational therapist, and physiotherapist their role will come, like how they will walk. Do they need a stick? Do they need 2 sticks? So how they will manage. So I think it's a teamwork. So yeah, there are alternative pathways as well.
So is there a difference between if somebody wants to be a psychiatrist, they have to go with the medical degree, or they can go into a graduation in psychology and still practice that? Is there any kind of examination involved in practicing that?
So psychiatry is a specialty of medicine. So you have to become a general doctor first, and then you have to train as a psychiatrist.
Okay.
The reason is that there are a lot of mental illnesses that are still connected with our physical health.
Okay.
So you have to understand fully, our body and medicine to be able to, for example, dementia falls under psychiatry. And people with dementia have heart diseases as well.
Okay.
So for a psychiatrist to manage dementia, which is a memory problem, they also have to manage their heart problems too. So they have to be a general doctor. Same way for dermatologists.
Interrelated things.
Yeah, same way like you mentioned about dermatology. There are some skin conditions that are linked with cancer. Or, I can't think of any. Can you think of any skin conditions right now? I'm trying to think that are actually, there is a disease of the intestines. And it first presents with skin rashes. So you have to be a doctor and understand that that skin rash is linked with intestines. And then you have to treat the intestines. And so they're all, the only non-medical fields where you don't have to be a doctor is, like Dr. Zahid said, occupational therapy, physiotherapy. Those are shorter courses.
Okay. Thanks. Thank you, Dr. Nazish. I have another question from Shraddha. It's homeopathy, allopathy, Ayurveda, etc. So many branches are in practice. As per you doctors, which is the best one? What would be the obvious answer? Well, I would, I'm not a doctor, but I would say all these branches have their own unique selling,
Definitely.
I think it's more of a matter of time and faith with these kind of homeopathic because my grandfather was a homeopathic doctor. So I was, I have grown up with homeopathic medicine, and I have a faith that it works, but my husband doesn't believe in that. He says it doesn't work, it will take ages for this to cure. So, I mean, but what would you say? What I think she's trying to ask is, what are the scope of these lines, homeopathic, allopathy, Ayurveda, as in the doctor's current profession?
I think now medicine is so alternative, like people want to try different things. And, it's people use Chinese medicine, and they have, there are so many types of different fields there. It all depends. I think especially when you're based in Dubai, people try a lot of things like, acupuncture is there, and hijama. I don't know if you've heard of hijama. That's sort of the cupping thing. Yeah, it's in, and I think all these big Hollywood actors and sort of celebrities, they are getting treatment through cupping and all, and they are seeing a result. So there are like different fields. Yeah, but medicine is the best.
That's a good one. Then I have another question. I'm glad people are asking questions. This is from Parth Shetty. He says, what is the scope of veterinary medicine or veterinary science nowadays? And will it increase or decrease in future? I know it's not your field, but still.
Okay, I think again it has a very good scope in Dubai. Actually, if you're talking about Dubai,
I know why you're saying that.
Yeah, because I don't know if in Dubai, because they are into sort of horse racing, camel racing as well. And I know they are very well paid in sort of Middle East if they go into veterinary medicine. And I think they have a good scope. And even in UK and all as well, UK and Canada, like to even have a pet at home, like if you have a cat, you need to have an insurance.
Right.
Because if simple thing happens, like my friend actually, his cat had a fracture of one of his leg. And it costed him like almost 3,000 pounds, but luckily he had insurance. So I think it's a good field. And
Yeah.
That looks promising. Now I have a question from Sabiha. She says, after completing MBBS in India, what should be done to work as a doctor in Saudi Arabia? Would you be able to help with that?
What I would say is, I mean, I trained in UK, and it's very important. When I graduated, as soon as I finished medicine, because it was 6 years, by that time, like you said, that a lot of people our age have already finished their degree and they're already working. They've already started working a year or two before us. It's very tempting at that age when you're so young and you finish 6 years of hard work. You want to grab onto the next best opportunity to start working. And that's where it's very important to hold on to your emotions and take a step back and do your specialization. Because outside the Indian subcontinent, just an MBBS is nothing. You are still not, you're not still that well qualified to be managing people's health. It's like people's lives on your hands.
And I think every country has their own licensing procedure also for the doctors.
Yes.
So apart from this, you have to give a license exam. If you get that, then only
licensing exam. And the thing is that you can get very easily tempted to move to the Middle East after doing your MBBS, like Saudi Arabia, and you may even find a job. But after 2 or 3 years, you'll see the career progression isn't much. Because if you haven't specialized, your salary bracket is not going to change. It will stay the same for the next 10 years. And that's when it becomes very frustrating. So it's important that, yes, you do your licensing exams. You may even get a job after doing medicine. But if you move to the Middle East without specializing, after a few years, you'll start to really struggle. Because times have changed and you do need a specialist qualification to move on.
Yeah, that is there. Then there is another question in which Parth is asking, what is the procedure to apply for a bachelor's degree in the UK? Are there any exams to be written? So did you guys have to qualify an entrance test to enroll for your bachelor's degree program?
So, I mean, this is a long time ago and rules may have changed. You had to have minimum number of A grades or percentage to qualify. And then you would apply to, you'd be given a choice. So in UK, you have to apply through a central application system. And then your application is matched with you are asked to choose at least 3 universities.
Right.
And then your application.
The UCAS portal helps.
UCAS, exactly. Yeah. And then you have an interview. So, yeah, I mean, the prospects are good because UK is incredibly short in doctors.
Right. Okay. Let me see. Is there another question? Yes. Okay. Who has asked this? Aditya. Aditya has asked, how has AI influenced clinical practices and has its use created changes in this field? He's saying, has artificial intelligence influenced the clinical practices which are happening these days?
I think in Middle East, yeah, they are doing a lot of surgeries, robotic surgeries. But again, some people, it all depends actually. I think it's very new. So over a few years, we will see a difference. We will know where exactly we're heading to. But still, I think some people prefer like normal surgery rather than a robot operating on you.
Yeah, since it's a new thing, it's not.
Yeah. So it's new. We'll
it's
see
just like the
years.
COVID vaccine. Nobody is trusting it, whether it will work or not.
No, it is working actually. They have done research in UK, and basically people who have had COVID vaccination. Even if they get COVID, they have very mild symptoms, and most of the time it works actually.
Yeah, I am a witness to that. We are all taken 2 shots, but my husband got COVID, and but his symptoms were, he was asymptomatic, actually, very mild symptoms, 99
Okay.
fever.
Yeah,
So I
yeah,
think
yeah, yeah, yeah.
it does work.
It does work, yeah, definitely.
Yeah.
So Aditya, artificial intelligence is all over in all the fields these days, and I'm sure the medical field is also having it. And overall, artificial intelligence has a great scope. So you can aspire in the futuristic career options in that field. Then next is Anaya Saxena. Can we complete MBBS in India and then further do MS or MD in foreign? And do we have to give any other entrance exam after medical degree for being specialist?
Yeah, there is always an exam, as you mentioned yourself, you know, no matter which country you go to, you have to sit for exams.
You have to follow their medical
Their guide,
protocol.
definitely, yeah, their protocols. And I think most of the countries have, you know, they have their own licensing exams as well.
Right.
And it
right.
depends what sort of license you want. So it's at different stages, you have to give different exams.
Here you get your license from DHA?
Yes, DHA, yeah.
And I think in US, it's US MLE, right?
Yeah.
Yeah, US, yeah, that's one of the exams, yeah.
So now it totally depends which part of the world you're planning to go, and they will have their own set of protocols. It's not like that you are done and dusted in India, then you can directly go and start there. You have to follow the procedure of the country where you are going.
Yeah, I mean, I think what I'm looking at a question, if she's asking about, do you have to, can you complete further masters in a different country? You can do.
Yeah.
Again, do the entrance exam like USMLE or in UK PLAB, and then you have the opportunity to specialize and do your MD or MS.
Okay. Now we have a very interesting question from Shraddha. When there are so many doctors with expertise around all over the world, why has not a suitable medicine been found out to stop this pandemic? Will it be done in near future? As doctors, you must be getting the updates. Could you share with us, please?
I think they're, I mean, I think to be very honest, they have a half or 2 years, they have found a vaccination, and I think we are looking improvement. The COVID cases have gone down in the countries where they have vaccinated at least 70 to 80% of population. So we are seeing numbers have gone down. So there is, I think, there's lots happening, and it's because of medical profession and research. Yeah.
See, of course, things are in control, but to prove the current things, we need factual data also, and it will only be building up over the period of time.
Yeah, definitely. Yeah.
Okay. Now, another question is, what is the process for foundation years and internship in the UK?
So again, you have to first finish your medical degree, and then you have to do the entrance exam, which is PLAB in UK. It's in 2 parts, and then you foundation, the 2 years of internship, it's advertised as jobs. So then you have to apply through their central application system, and then you start your 2 years of internship. And you're very well supported there. I mean, UK is quite famous for its style of education, which they've been doing for 200 years. So they look after you quite well as a junior doctor.
All right, thank you for that. Then I would like to ask Dr. Nazish and Dr. Zahid that what risk you have to face in your profession.
I think risk is there that, sometimes a patient, we get a patient who is sort of semi-conscious or is sort of very unwell, where they can't give a proper history. And sometimes we have to treat them without sort of taking history. And sometimes, you know, let's say they're allergic to any antibiotics, and by mistake we give them, they can have anaphylaxis shock, which is basically which is a serious kind of allergic reaction where they can stop breathing, they can have swelling of the lip and the tongue. But obviously there is treatment for that, so that's the risk actually, you know. But obviously we can still treat the anaphylaxis reaction as well.
Okay.
Yeah.
Do you want to say something on that, Dr. Nazish?
Yeah, I mean, the risks are many. Like Dr. Zahid said, there's medicines, there's, I mean, right now it's the pandemic. So that's the greatest risk. So we have to wear shields, which we'd never imagined that we'd wear. You know, there's sometimes you have to, I mean, I just remembered it right now. In UK, we have what's called Jehovah's Witness. So they do not take, they do not accept blood transfusion. So sometimes you just take that risk if that patient is unconscious and we do not know what their religious belief is. And we have to save their life, and we could give them a blood transfusion, and later on when they are well, they could complain that you gave us something which is against our beliefs. So there are quite a lot of risks, but there are ethical committees and there are support you know, groups which support doctors throughout their journey.
Yeah, that was there. So doctor, what do you, if you want to give suggestion to the students, what specializations they should focus on, which has more growth prospects, which is having more of, you know, futuristic job requirements in the fields? What would be your top suggestions?
It's bringing a joke in my mind. When I was training, when I was a junior doctor and I was doing orthopedics, I'm not going to mention any specialty which I'll say is the best. I'm just sharing an interesting experience. So when I never liked orthopedics. I hate broken bones and I hate fixing them. So you see, you cannot love everything that you do in medicine.
Right.
So, but when I had to do orthopedics, one of the orthopedic surgeon who was my senior, he had his own helicopter.
Okay.
So when you're asking me the question,
so you're telling me the driving force is the helicopter? All right. Okay. That is good one. Do you want to say something, Dr. Zahid?
I think what happened in medicine, because when you are sort of getting your MBBS degree, you sort of get a taste of all the specialty like surgery, orthopedics, medicine, elderly medicine, which is called geriatrics, and then working in a child's ward as well. So you get a lot of exposure to different fields, and I think you can decide what you like, and I think it's all depends on personality, you know, what you like. So yeah, so it's difficult to say what specialty is the best specialty. I would say family medicine, by the way, because
And one thing which I come across a lot, you know, that when you ask the person or the student, why do you want to go into the medical field, they just want to say that they want to, you know, give back to the society. They want to help. But do you think there are other ways as well of giving back to the society? Is picking up this should be the main reason to select medical as your career, or you need to really think and validate your choice, because there are many other ways in the same field outside this field to give back to the society, like, you know, firefighters, social workers. There are so many people there. So Dr. Nazish, what do you think on that?
I think yeah, there are many ways to give back to society, and I think everyone who's working is giving back to society in their own unique ways. You know, like you said, a firefighter, a teacher, even a bus driver. We cannot, or a pilot, or a taxi driver. They're all giving back to society, and they all deserve our respect. I think you would know this better, and you would. It's a very long field with lifelong learning and a lifelong commitment. And at some point, if someone starts this career and some point during the line they feel this is not for them, I don't think it's end of the world if they want to change. Times have changed and there's so many opportunities. If someone gets into this field and after 2 or 3 years, we had by the end of the first year of medicine, there were 10 boys who had left medicine from my batch.
Okay, that's an interesting thing.
Yeah.
Yeah, I just wonder why Dr. Nazish said boys.
Oh, I know. See?
Yeah, but
no, there were
I have
actually
also
2 girls
seen
as well. I must correct myself. There were 2 girls and 8 boys. Yeah.
Yeah.
So there's still hope. They can go into different scientific fields if they realize afterwards that this isn't
I think
for them.
there is where career counseling is important, because after doing 1 year, since they were not happy and aligned, and I have a student who has done engineering, completed her engineering, done with good score, but she didn't enjoy doing that. She is still not able to, she doesn't want to work in that field. She just did it because that came her way and it was selected by her parents. But yeah, I know in yours and my time, there were not many assistants and help available to help, in figuring out what we like or what, because if we go back to our parents, they would think that we are coming with options influenced by our friends and not ourselves. And then what they have done, they want to replicate the same journey on their children.
Yeah.
So that is, in fact, that is a struggle I also face all the time, because parents consciously or unconsciously, they try to replicate their life journey on their children. But we have to see that the whole, scenario has changed. They don't have the childhood what we had.
Yeah, definitely.
And it's very important to align their passions, their skills and strength into the field they really want to go.
I think I totally agree with you.
Yeah, thanks. I think I have another question for you. So how do you work on your work-life balance? How does it affect your personal life?
What is work-life balance? It doesn't exist for doctors.
No.
You're killing the hope right away.
No.
So what tips, how do you manage yourself? How
The main thing is that I think it's in any field. Once you finish your job, I think you should mentally be ready that, okay, I've done my job for the day and that's it. Not bringing your stresses from work at home with any sort of stress. And I think your work as well, if you bring it at home, then it becomes difficult because you can get mentally very tired.
Yeah.
So yeah, I think you have to. I think these days, I mean, if I speak to the doctors who were senior to me, they used to work sort of 90 hours in a week, and I don't know how they did it.
Yeah.
And now these days things have changed. Like, we are okay to be sick, so doctors can be sick, and they get like, in most of the countries they have these working hours, like they can work 40 hours or 44 hours, something like that. So you cannot work more than that. So they are looking into sort of helping people to keep their families happy and sort of continue to work as well. So you have to get that balance. Yeah.
So which makes me ask you another question, that what makes you get out of your bed every day and go to work? What is the driving force? I know you can have a good day at work, you can have a very exhausting day, depressing day, but still you gather yourself and so what makes you do that?
I think it's just sometimes, you do a job, like I'm just giving an example in A&E, if I fix something, or even as a doctor, we sort of treat a patient who was very unwell and they get better. So sometimes they, the family thanks us so much with sending a thanking card. So that sort of, it makes you motivated to get up and work. Yeah. And just a small, I mean, in any field, I think it's small thanks, no matter what field you are in.
Yeah.
If you get a small thank and, you know, you show them empathy, which is very important, that, you know, you are doing things, something for you. They're doing things for you. That
Right.
really helps. Yeah.
It's very, there was a psychologist in America, and he said that it's very rewarding. It's very, that sense of gratification when you give and you bring comfort or smile. And that's not just with a doctor's hat, it's with any profession. When I was doing my internship, so I was doing my foundation years, and I was in emergency medicine, there was a man who came at around 10 or 11 o'clock at night. He must be in his 60s. He was tossing and turning in pain. He couldn't pass urine for the last 24 hours. His bladder was blocked. And I was a house officer. I had, like you asked before, right, that the difference between education and experience and what's important. I had seen videos and I had practiced on mannequins on how to put the catheter in so that the person can urinate. But I'd never done it on a human being.
Yeah.
So it's scary. But when I managed to get that catheter in and he passed urine, the relief that he had on his face, and he just continued, and he continued saying over and over again, the doctor, today, even if you bought the lottery ticket, you'll win because my prayers are with you. So I think those patients' lives become connected to you, and then you wake up because you know that there is a patient whose blood results will be back today, and we'll find out what's going on with him, or his CT
Your
scan will be
commitment
back.
and your responsibility. You feel that.
Yeah.
Okay, that's good. You know, it's the driving force for anyone to go and get back to their profession. I have another question. It's from Uneza. Which type of medical professionals, apart from doctors and nurses, are highly required to work with patients and can get into research work? So apart from doctors and nurses, I think we took up this in a different way.
So is she trying to ask that what other job roles require people to work with patients
apart
other
from
than
doctors and nurses, what are the other job positions available to work in this field, and if it can be into the research work as well? I would like to request the audience, if they have questions, please post it. We're already done with the time. We'll give an additional 5 minutes.
So this is, I mean, I think like Dr. Zahid had said earlier about physiotherapists and occupational therapists, and he was saying that we work as a team. So they are also first point contact with patients. You know, in terms of research work, after a bachelor's in scientific fields, you can go into research. Biomedical sciences, I think they're about 2 or 3 years degree course.
Even biotechnology is popping up a lot. Even there, I mean, in the medical field as well, and in the engineering field as well, there are options of biotechnology. Okay. So yeah, that's fair enough. Then Aditya wants to ask, is the internship in the UK done with the NHS, or do we have to do it in our home countries?
Okay.
I think, well, it is done under NHS, but there is a way, like if you do internship in your home country, you still have to sit for the exam, which is PLAB, and then you can get into the system. Again, I wouldn't know much about other countries, but I know in UK, the foundation year, which is internship, it's divided into like 2 years. And what happens with that, you get like opportunity to work in different specialty, like 6 different specialties. So you get wide range of experience.
Okay. One last question we will take up, and then we'll close it. Shraddha. Yeah, she's saying my request is every flight must have doctor to help a struggling patient, because when I was traveling last time, I saw a patient struggling for breath and unfortunately there weren't any doctors. Such things kindly advise the aviation department. Noted. Next are pilots. Next week pilots are coming. I will put it forward. Yeah. So, doctors, thank you so much for your valuable time, your tips, your experience. I'm sure it has helped me a lot. It has helped the people here as well. I would just ask the last closing question to both of you. What tips or guidelines do you want to give to the students who are aspiring to be in this field?
I think one thing I would like to say is there is a very famous saying of Maulana Rumi. I don't know if people have heard about him or not, but he's got a very best saying. He says that when you are born with wings, why to crawl? Learn how to fly.
Yeah.
So I think it's the hard work and the challenges with any failure, or you face any failure, you pick up yourself mentally. You have to be strong. You pick up yourself, learn from your mistakes, and move on. So that's very important in life, in no matter which career you are in. And I think you have to be honest as well. That's another thing.
Yeah.
You have to be very honest to work, whatever work you're doing, whatever profession you're in.
Thank you, Dr. Zahid. Thank you.
No, thank you very much. It was my pleasure being here.
And we are honored to have you.
Thank you.
Yes, Dr. Nazish.
No, I think Dr. Zahid has summarized very well. So when I was training in psychiatry, we were given a psychologist to help us, because with psychiatry, because there's a lot of intense mental health work that's involved. So as part of training in psychiatry, because in UK, you have to train in 4 months in different fields before you decide what you want to do. So when I was doing psychiatry, we had a psychologist who said that remove the T from I can't and just keep it I can.
Yeah.
When you go into any field, whatever you decide to do, the moment you say I can't, you won't be able to.
Yeah.
And we measure success with achievements, and how much we've achieved, which tells us how successful we are. We all learn from our failures, and that's what brings us to whatever our level of success is.
Right.
So never feel down or disappointed if you didn't get into the field that you wanted, or if you changed your mind afterwards. As long as you're working hard and you're honest with yourself, like Dr. Zahid said, you'll get there and you will be contributing towards humanity in your own unique way.
Yeah, that's true. That's true. So I would like to summarize it as that, as you both said, that one needs to be honest, one needs to be having a strong grit and belief that they can do it. Determination is very important. Also, it's very important to understand yourself and validate your thoughts. And it should not be observations. It should not be suggestions. It should not be your friends and parents. You need to talk to many people who are closely associated with you, be your teachers or the people who you work with. Take their insight, and you should first know yourself and then align your choice of career with that, so that the hit and trial in the future reduces and you are in your happy space.
Yeah. I'm really sorry. Someone had posted a question and they've posted it twice. I think we missed it, and they wanted to know which countries do you think are the best for psychiatry?
Psychiatry, Giant. Yeah.
I think at the moment it's because pandemic is all over the world, and we are seeing a lot of mental health patients. So no matter where you go. But thank you very much. You're doing a great job. I wish in our times we had people like you who would help students to choose a career. It would have been great, actually. So you're doing a great job.
Thank you, Dr. Zahid. Thank you, Dr. Nazish. You have been so wonderful, so nice. And now it's a lifelong association with you all.
Yes, definitely. Yeah. Thank you very much.
Thank you. And thank you, everyone, for taking out time, joining us. If you still feel you have any questions left out or you have more queries, please feel free to email it to us and we'll get back to you. Thank you.
Thanks.
Thank you, Doctor. Have a good evening.
Bye. You too. Bye.
Bye.